Good morning. Are you Mrs. Washington?
Why, yes, I am.
We're here for Mr. Washington's follow-up visit. I hope the office let you know we were coming.
Yes, gracious me, but I wasn't expecting so many people, such a crowd. I'm very glad that you all are here.
Hello, Mrs. Washington. It's Dr. Walker. It's nice to see you again.
Good afternoon, Mrs. Washington. My name is Cal Patel. I'm the pharmacist, and I specialize in medicines.
All right, now this is my husband, Mr. John Washington.
Hi, how are you?
Well, the three of us came here to see you today because we each have our own specialty, and we're going to work together to help Mr. Washington stay healthy and out of the hospital. Well, since this is the first time we're all meeting together in your home, we wanted to check and see with you if it was okay if Mrs. Washington participates in this conversation.
Oh, yeah. Yeah, look, we've been married 40 years. She's always been the one to keep me on track. Don't know what I'd do without her.
40 years is great. Well, I'm glad that Mrs. Washington will be able to participate. So, how are things going with your diabetes?
I don't know how other folks do when they get home from the hospital, but for me, things have been going pretty good.
How do you feel you're doing on your new medicine so far?
It seems that as soon as I get familiar with one, they change it up on me. Oh, they change the strength or change the medicine altogether, and then I just don't know which one to take and which one to stop taking. And on top of that, they got these long, fancy names that I can't pronounce, and I just don't know which is which sometimes.
Yeah, I understand how frustrating that can be. Medications are often difficult to remember. So I see these bottles on the table here.
Well, to tell the truth, these are both our medicines. See that over there is my wife's, and that's hers, and this is hers. We got them all mixed together. And this is what they gave me when I left the hospital.
Now, these inhalers, these are mine. We keep our medications out here on the living room table so we won't forget to take them, you know?
Okay, I see. Mr. Washington, I'd like to work with your wife to separate her medications from yours.
Oh, sure.
Okay, so let's take a look at these medications. Now, from a safety standpoint, it's best to keep your medicines at separate locations. So it's better that way so that you don't end up taking one of your husband's medicines or the other way around.
Mr. Washington, while they're sorting the medications out, can you tell me why you were hospitalized this last time?
Hon, can you answer that?
Oh, it was his blood sugar.
Okay, so it was your diabetes that made you go to the hospital.
Oh, yeah, I guess she's right. Yeah, I don't know what it was that exactly made me end up in the hospital. I just know that I was confused and,
Oh, now, he's usually very sharp, but he just wasn't acting like himself. He just wasn't acting right.
my mouth was dry and I couldn't get enough to drink. I had pain in my stomach and I was just tired and uncomfortable.
Was this the first time this had happened, or had it happened before?
No, it's the first time. Never happened before. My wife got a little nervous, so she took me to the hospital. They said the sugar in my blood was high, and they wanted to keep me there a couple of days.
Was anything different going on at that time?
When I sit down, I'm fine. But then when I stood up, I was really dizzy and really thirsty, and my mouth got really dry. I couldn't get enough orange juice.
How did you feel after you drank the orange juice?
I drank a lot of orange juice, and all day I just got drier and drier.
Was it regular orange juice or was it this?
Oh, this is what I usually drink.
That's what I thought. Okay, look at this. If you look at the nutritional information on this label, you'll see that this isn't really like orange juice. And it has a lot more sugar. So the day that you wound up in the hospital, you were feeling tired and thirsty because your sugar levels were high. And then you drank this, and that added more sugar. So this was actually making your symptoms worse. And that's why you were thirsty and kept drinking and drinking.
Yeah, she makes a good point. If you ever feel that thirsty again, drink water and call my office immediately or go to the emergency department.
Water.
Yes, water. We recommend that you drink water because water doesn't have any sugar in it. That's where the medications can help.
So let's take a look at these medications here. Which ones are yours, Mr. Washington?
These.
Which ones are for diabetes?
Okay, let's see. All right, we have the sitagliptin and metformin. Those two.
And how often and when do you take these?
All right, let me see if I can get this right. It's a little confusing, but I think I take the S drug twice a day, and I take the metformin once a day in the morning.
Okay, so this label, it says to take the S drug, sitagliptin, once a day, not twice a day.
All right.
Now, that is very important to remember because you don't want to go through the risk of having too much of the drug in your body and then your blood sugar level goes down too much. If your blood sugar level is too low, then that can be very dangerous. So you can take these, this one with the meal or without a meal, completely up to you, but it must be at the same time every day. Now, the metformin, you take this with the meal 2 times a day. So, to make sure that I have correctly explained this to you, if you could explain to me how to use these medications.
Okay. Can I look at the labels?
Yeah, sure.
Okay,
Relax. I want you to
Need
take
my
your
other
time.
eyes for that.
Yeah.
All right, we got the metformin. This is what I take twice a day with meals. And because meals begin with an M and metformin begin with an M, it'll make it easy for me to remember. Now, the S drug, I take once a day at the same time.
Great.
So what I would like to know is, have you ever used a pill organizer to organize your medicines?
Now, someone did mention a pillbox at the hospital, but I wasn't paying attention. There was just so much going on.
Oh, I know.
I just wanted to get him home.
I'll bet. But I can give you a couple of them, one for each of you. And your homework assignment before the next time we meet is to separate out your pills from his pills and organize them by day into each of the 2 boxes.
Okay,
Okay.
that'll be good for us.
Be fun.
Yeah.
Okay, well, before we leave, do you have any questions?
Well, yes, I do have a question. What is your name? I don't think you told us.
I'm really sorry. My name is Kathleen Robertson. I should have introduced myself at the beginning of the visit. I'm the home visiting nurse.
Oh, okay. I just wanted to make sure for our next visit.
Okay, I'm sorry.
Okay then. Well, we're going to see you in 2 weeks. We're going to check and see how you're doing. In the meantime, if you do have questions for one of us on the team, go ahead and give my office a call.
Okay.
Hey, good afternoon, everyone.
Hi.
Good to see you guys. Is everyone doing well?
Yep.
Wonderful.
Good. The reason we're meeting today is to review Mr. Washington and his wife's visit, our last visit, and to go over a plan for our next visit.
I followed up with the phone call to Mrs. Washington 3 days after our last visit to see how they were managing with their medications. She said they are keeping their medications separate on opposite ends of the living room table, and they are using the pill organizers, which seem to be working well.
Okay, great. I'm glad to hear this. Thanks, Cal, for calling his wife to check on that.
I was also wondering if we should also have Mr. Washington start on a daily dose of aspirin, given his history of hypertension and diabetes.
That's a good thought. I'll have to take a look at his medical history. Thanks for bringing that to my attention. So jumping back a bit in time, how does the team think our last home visit went?
Fine, but I left out something so basic. I forgot to introduce myself when we first arrived. I was very glad that Mrs. Washington brought my attention to it, though.
It's important to remember to introduce ourselves to our patients and so they understand who we are, especially when several of us visit at the same time. Cal, do you have any thoughts?
I thought it was a good home visit. each of us offered Mr. Washington something unique from our own professional perspective. Together, we gave him a package of tools to help him stay healthy and hopefully help him stay out of the hospital.
Yeah, I would agree with you. Is there anything else we should consider before the visit tomorrow?
Nothing that I can think of.
No? Okay, great. Well, then I'll see you both tomorrow.
Good morning, Mrs. Washington. Kathleen Robertson, the nurse.
Oh, come in, come
Okay,
in.
yeah.
Come on, right.
Hello, Cal Patel, the
Good to
pharmacist.
see you again. I remember you.
Good morning.
Hi,
Good to
sir.
see you again. Is that okay?
That's fine,
Okay,
that's fine.
great. We're here to see how you're managing with your diabetes. How are you feeling today, Mr. Washington?
I feel okay, but I've been feeling really tired though.
Really tired, like fatigued more than usual?
Yeah.
Huh. Let's talk about that fatigue for a minute. How are you doing with your medicine and checking your blood sugar?
Well, the pill boxes work great with help keeping us organized.
Have you been taking each one of your medication at the right time of day?
Well, yeah, I do as best I can, but sometimes I do forget.
Which ones do you sometimes forget to take?
The ones that manage my sugars.
Well, that may explain why you're feeling so tired. One of the symptoms of high blood sugar is extreme tiredness or fatigue.
Help me remember, what drugs do you take for your diabetes?
Oh, I take the metformin twice a day with meals, M&Ms, and I take the S medicine once a day in the morning, same time.
That's great. That's what we talked about at our last visit.
And are you able to keep track of your blood sugar numbers?
Well, my wife does that. She's pretty good at it.
Here are his numbers. Here are his numbers.
And do you know what the numbers mean?
Not really.
Okay, all the numbers mean is how much sugar is in your blood. And it just gives us an indication of if they're in the normal range. And we just want to help you know whether it's too low or too high.
And what foods make it high?
Candy, orange juice, cake, bananas, bread, things that are high in sugar.
Well, wait a minute. Now, I understand how candy and orange juice can make it high, but bread? Come on, I thought bread was good for me to eat.
Well, it depends. We can go over a list of foods that contain sugar. But, why don't we set up a consultation for you the next time you come into the clinic with a dietitian? They'll help explain better what foods contain sugar and what foods you should avoid.
So let's have a look at the recording of the blood sugar numbers. I'm sure Dr. Walker wants to see this.
Yeah, so let's see. The numbers are 160, 180, 200. Those are high. I also see a 50. When do you do these finger sticks, Mr. Washington?
Well, like the nurse said, I should do them before meals and at a bedtime.
Well,
But sometimes I forget, and then I do it after breakfast. I guess those are the high ones.
yeah. Well, it is better if you do check your blood sugar levels before you eat as well as before bedtime. That's important to remember. We want to see your blood sugar numbers throughout the day before you eat as well as before you go to bed. This can help us determine if the medications we're giving you are working properly.
Oh, okay. So we should probably write down when he ate, along with when he took his checked his blood sugar, took the finger stick, and especially take it before meals.
Right, that's exactly right, Mrs. Washington. I have a form here.
Well, hold on a second. That's important to remember because if the numbers are consistently high, we may need to make an adjustment to his medication. And I'm sorry, you were saying?
No, that's okay. So I have a little form, it's a chart, and you can keep track of the times of day and the numbers and when you eat. And it just might help you keep track of the whole thing. Would that be helpful, do you think?
Oh, certainly. Yes, it really would.
Okay.
Certainly would. Thank you.
Mr. Washington, do you have any pain or tingling in your hands or your feet?
No, that's one thing I do not have, thank goodness.
Good. Do you check the skin on your feet?
At the hospital, they told me to check between my toes. So I got this nice little mirror, it's a telescope, so I can look between my toes. And I asked my wife to take a look.
You're a lucky man.
Yeah.
Well, that's great, but you do need to do that every day because you really don't want to have any tears in your skin or any infection. Okay, well, Mr. and Mrs. Washington, we've covered a lot today.
Mm-hmm.
Do you have any questions for any of the three of us?
No, I don't think so. I'm good.
All right.
Well, that's
you know how to contact us, and you have the numbers. If you have any questions or your health changes in any way, please contact our team. Call the office, okay? It was great to see you again.
My pleasure.
It was really great to see the two of you. Thanks for letting us use your home.
You're welcome.